Hello, this is Marco Gresnigt. I'm a dentist from the Netherlands. I'm the current head of restorative dentistry and biomaterials at the University Medical Center in Groningen. And I work in a special care clinic at the Martini Hospital, also in the Netherlands, in Groningen. This is the north part of the Netherlands. It's not Amsterdam, as probably a lot of you will know. But Groningen is in another part of the Netherlands. I was asked by Gary to give you a clinical tip, and I immediately said yes. I'm really happy to share with you a clinical tip. And you might know that I did some research. I published some articles on adhesive, restorative dentistry, aesthetic dentistry, and a lot on adhesive dentistry. So we did a lot of adhesive clinical articles, but also in vitro articles. And I want to give you some tips on that. So actually I want to explain you our protocol for repairing direct composite restorations or luting indirect restorations to IDS or composite restorations. So sometimes we want to make repairs because our composite restorations are still okay, but some small chipping or fracture happened. And sometimes we have teeth where we make indirect restorations. We have some dentin where we placed an immediate dentin sealing, but how to lute to these materials again, to the IDS layer, or maybe you did a deep marginal elevation, or you did or you still have some composite restorations on your teeth and you don't want to take them out, or maybe some core buildup of composite, how to lute to these restorative composite materials. So I did my PhD on that, and we have some 10 years result of laminate veneers bonded to IDS, but also bonded to composite restorations, and these have super nice results, around 95 to 99% of survival in 10 years. So this is very, very good. You can look on PubMed to find my articles over there. But the protocol, as I want to give you a clinical tip, is the following. So when you want to lute or repair the composite restorations, you can the first step is to silica coat the composite or the IDS layer. So the composite needs to be silica coated, which is some kind of sandblasting with special sand. The sand is aluminum oxide particles coated with silica, and due to the sandblasting, the silica will form a small layer on the restorative composite, and this layer is embedded into the composite, and by that you make the composite anorganic, and by making it anorganic you can lute to it. So this is very nice. So the first step is silica coating of the direct composite or the IDS layer. This is the first step, so sandblasting the composite restoration. Next step will be silanization. So silanization is making, it's a fluid which you can apply on the composite restoration or on the silica coated composite restoration. And this makes the connection between the anorganic silica and the organic adhesive system you're using afterwards. So then the second step is to apply a silane. And the third step will be adhesive again. And the adhesive will form the bond again with the silane. And then you can just repair it with a normal composite, or you can lute the indirect restoration on top of the bonding system. So these are the steps. So 3 steps. First step, silica coating. Second step, silanization. Third step, adhesive resin as a bonding layer. So good luck in your clinic with repairs. or maybe with luting indirect restorations to composite restorations. And if you want to reach out to me, or maybe you have some questions, you can always send me an email by marcogresnigt@yahoo.com, or what you can do is look at my Instagram page at marcogresnigt. And if you have further questions, I'm looking forward to answer them. Bye-bye. Good luck in your practice.